Today's Wheelie Good tip is brought to you by Access Community Health. Thanks guys for your support.
So what you need to do before you have a hospital admission, if this is a planned admission, it's quite likely you might be going in for some surgery. Before you have your planned surgery, generally the pre-admission team will give you a call. They'll give you paperwork, but they'll also give you a call. It's usually from a pre-admission nurse. Super important when you speak to them is tell them exactly what you need for your care. This could be anything from equipment to pressure relieving devices to accessible call bell, as well as something that you can put your phone on, that sort of thing. So making sure or asking what they have prior to you going in. What you need to bring if you're going into hospital for a planned admission is things that they have asked you to bring. So usually it will be definitely your medication or a medication list. Really important to take things that enable you to get up and get your day done. So this could be things like your toilet commode chair, if it's something that is going to be an option when you get into hospital. If you need a CPAP breathing machine at night, take that. As I said, your medications for a few days, they will generally give you medications in the hospital. Obviously your toiletries, but also your lotion and potions that work for you. Also just anything else that's on the hospital list, make sure that you've gone through that with a fine tooth comb and tick everything off that you need. So you might be concerned about how the hospital will be able to look after you if you're going in for planned surgery. So this is where all your pre-planning comes into play. So as long as they know what your care needs are on a day-to-day basis, they might change obviously after surgery. So you can, if you have a support plan, a community care plan, or your care needs checklist, you might be really good for you to bring one of them in, so they'll be able to look. If you're not able to talk through your care needs when you've groggy after surgery, this type of thing, it'd be really important for them to know how to look after you. The other thing is there's sometimes options that your support worker can come into the hospital. This is an arrangement between either ACC or the Te Whatu Ora. There is systems in place for that, but it's still something that you should ask before you go into surgery or into the hospital. Also, again, you know your own body, so before you have your surgery, talk to the nurse or whoever's looking after you for the day, explain your care needs. One really important thing is making sure that you've got access to a call bell and how that works. Make sure that they've given it a test so you know you can hear it and somebody can come with you. And quite often you'll be able to have a family member there as well. The other thing is if you are using intermittent self-catheters, there's a possibility that you might have to use an indwelling catheter after surgery, but the team there will be able to explain that to you. And again, stick to your bowel routine. Unless it is for bowel surgery you're going for, it's really important just to make sure that they keep to that as well, because you don't want to be sick while you're there, obviously. So we've talked about planned admissions, but unfortunately you may have to go into hospital for an emergency. It's quite good for you to have a grab and go bag, even if it's just some jammies, some basic toiletries, and a note in there about your care needs and what is important to you. If you have to go to hospital for an emergency, you might not be able to talk about your care needs as well as what you would hope. So it'd be really good just to have something written down that you're able to pass this on. Again, if you've got care support at home or families that are able to tell the paramedics or the team what's needed and what they think is wrong. Also really good to grab some catheters, catheter bags, just again, things that are really important for you while in the first couple of days. Also really important, even if you don't use one at home, is a pressure relieving mattress or anything that allows pressure relieving. If you're unwell, you will most likely be in bed a lot longer than what you would be at home. So it's really, again, important to have something to offload that pressure as much as possible while you're unwell. So if you are in hospital and you think you're going to be in there for a long time and you don't normally use a pressure relieving mattress at home or an air mattress, it's still really important to know that when you go in the hospital, you can ask for these. It just means that it's a little bit of comfort knowing that you have got a really good device underneath you, because you won't possibly be moving as much and you might be actually quite unwell and either forget to turn, or the staff might be just a little bit too busy at the time to turn you as often as you would like. So when you're in hospital and you want to make sure you are getting your care needs transferred between shift to shift, you will have to explain each time to either the healthcare assistants or the nurses about what you need each shift. This could be 1 hourly, 2 hourly, 3 hourly turns. It could be other positions that you need to be in, when your pain meds are due, when your catheter needs emptied, and your bowel routine and things like that. It might seem repetitive, but it is just really important. And once they get to know you, they'll be able to get into the routine really quickly. So if you go into hospital and not feeling 100%, as anybody knows, you might come across a little bit grumpy and possibly not yourself. It is super important though to get really good communication and a respect and a good relationship with the team that are around you. It's just, if you keep things light-hearted but really informative, it will go a long way. They are just human as well, and it's just really good to get that good relationship and tell them what you need, and just it'll make the shift go much easier for everyone.